Happy Thursday. I'm Dr. Debra Wilson. I'm actually a gynecologist. I am technically an obstetrician gynecologist, but I practice gynecology in Scottsdale, Arizona. And you see here, and we'll revisit this. This is my office number and my email address. So if at any time you have questions, you're welcome to contact me, and I'd be glad to speak with you. So what we're going to do today, I'll tell you a little bit about myself and a little bit about my practice and why these BTL machines, this BTL technology has been so helpful to my practice. We'll look at BTL, the company BTL. Then we're going to talk about Emsculpt and Emsella. So I have Emsculpt, Emsella, Emtone, and Exlist, but we're going to concentrate today on Emsculpt and Emsella. Emsculpt has been out longer, and I think, but it's been quite a media sensation. We'll go through some of that. And then when we finish talking about Emsella, we'll talk about return on investment. I'll give you my numbers and talk to you about how we've been so successful, what kind of marketing we've done. And at the end, we'll talk about COVID-19 and how to come back from, you know, all of us have taken a hit, so how to come back from this. So a little bit about me. I'm a vegan. I'm an animal advocate. I have a rescue ranch called Circle Ranch in Prescott Valley. We have horses and burros and goats and sheep and chickens and turkeys and pigs, and we have a little petting zoo for kids. So it's a lot of fun, and it's something I've always wanted to do, and I've been able to do it, and actually been able to do it, you know, with a little more relaxation since I have had this BTL technology in my office bringing in money. So I'm also a mother, a grandmother. I have 3 grandchildren and 1 on the way in November. I've been on a number of medical missions to Nicaragua and Honduras, teaching local doctors how to perform laparoscopic hysterectomy. So I've been in practice for, probably 35, I think in July it's going to be 35 years. I was practicing OBGYN for years, and then when my laparoscopic surgery practice really started to heat up, I stopped doing obstetrics in 2005. And in 2016, we started offering some aesthetics, but it wasn't until 2018 when I added Emsella and Emsculpt that things really exploded. And they did. It was a huge influx of cash into my practice, which allows me to practice medicine in the way I want to, which is high quality. Patients call and they're rarely put on hold. They're rarely asked to leave a message. They talk to a real person. I can pay my employees well so that they are loyal and do a great job for me. So in 2018, I bought Emsella and Emsculpt, and then just about 6 months ago, I also added Emtone and Exlist. So, as I mentioned, we had a hard time. I have a big practice. I've been in practice for a long time. I've been a top doc, so it's a popular practice, but we do take insurance and we take Medicare, and it was no matter how busy we were, it was sometimes difficult to make ends meet, at least comfortably. But when I bought Emsculpt and Emsella, it really represented a game changer for me. So, why do we do this? I mean, it got to the point where I was looking around for some way to bring in some cash to the office so that things weren't always so tight. And I was hearing from my patients, geez, I'm incontinent, I'm having incontinence problems, but I don't want to have any mesh in my pelvis. I have a tummy, but I really don't want a tummy tuck because I don't want to go through surgery. I certainly don't want to have buttocks implants, but I would like my buttocks to look a little bit better. So I was hearing these things, and I heard from a patient that she had Emsculpt treatments with a local plastic surgeon, and she was really happy with it. So I started to look into it and purchase these machines. So, so when I talk to doctors about aesthetics about Emsculpt and Emsella, which, you know, Emsella really isn't aesthetics, it's more medical because it is treating incontinence. They say to me, well, I don't know if I have patients who, I don't know if I have patients who are going to want this. But think about it. Do you have a patient with back pain? You know, Emsculpt, it strengthens the abdomen, and that really helps with back pain. I hear that from my patients all the time. Do you have patients who just had a baby and she wants to strengthen her core and pelvic floor? Do you have an older patient? Because Emsculpt is not just aesthetics. It actually is strengthening the core muscles, strengthening the arms, so patients are less likely to fall. You know, it's if patients are stronger, they're much less likely to fall, and if they do fall, they can get back up. I mean, I have a neighbor, an 88-year-old neighbor, who fell the other day in her yard and couldn't get up. We had to go rescue her. I mean, fortunately, we heard her screaming, but anyway, that's another story. So what about men? Certainly we've had men on the Emsculpt machine, and we actually have had a few men on the Emsella machine as well, and we'll talk about that later. But somebody looking to boost his confidence, somebody newly divorced who wants to get out into the dating game, weekend warrior who really doesn't have time to exercise during the week, somebody who's made a New Year's resolution to get back in shape, and so that's a perfect candidate. Professional athletes are loving Emsculpt. Say a patient who just had a knee replacement and couldn't exercise for a period of time and would like a jump start, because the Emsculpt, you know, it causes muscle growth, it causes muscle strength, and so once they're done with Emsculpt, they find they experience being much stronger and more able to work out the way they want to. Bat wings, you know, we have arm applicators for Emsculpt, and these they grow the biceps and triceps and also reduce the fat in the arm. Somebody who has low testosterone and has a hard time building muscle, you know, getting in shape for a wedding, hasn't worked out in a while. So, and of course, patients who are incontinent. I mean, I have mostly at this point a menopausal practice because I've been in practice for so long, and so many patients are incontinent and obviously want to do something about it. So those are all the kinds of patients, and we all have those patients. If you ask the right questions and you put it out to them, they're going to be comfortable asking you about the technology that you're offering. So BTL, it's an international company with more than 53 offices around the globe, 1,500 employees, and more than 300 engineers. There are two divisions, medical, which is mostly cardiovascular, and aesthetics. Now, what I have in my practice are Emsella, Excellis, Emsculpt, and Emtone. So Emsella and Emsculpt are high-intensity focused electromagnetic energy, and we'll talk about that. Emtone and Excellis are a little bit different. Emtone, by the way, is a fabulous technology for reducing cellulite. Patients are absolutely loving it, and we're coupling that with Emsculpt quite often. In fact, I don't think I've seen a patient in the last few months who's had Emsculpt without adding Emtone to it. And Excellis is very good for skin tightening and also reduces fat. So let's get into the technology. High intensity focused electromagnetic energy basically rapidly changes the magnetic fields, induces currents in the tissue, works on the neurons, and causes supramaximal contractions of the muscles. So these are, keep in mind that these, and this is the way to present it to patients, is these are contractions that are much stronger and much more frequent than you could ever do on your own. You just can't do this on your own. So, you know, patients say, well, why don't I just do a lot of Kegel exercises? Why don't I do a lot of sit-ups? You're not going to achieve what you would achieve with high intensity focused electromagnetic energy. That's you know. So the great thing about this energy is that it's non-ionizing, non-radiating, non-thermal, and it doesn't affect the sensory nerves. So let's talk specifically about Emsculpt. So it is FDA cleared. It works beautifully on the abdomen, the gluteus muscles, the biceps, triceps, thighs, calves, and at this point, BTL is offering as an application the Emsella chair. So actually, you know, when I bought Emsella and Emsculpt, I bought them separately. And at this point in my practice, I have to have them separate because we run them at the same time. We have them in different rooms. But you have the option, if you're looking at buying something newly, of actually buying the Emsella chair that connects up into the Emsculpt machine. So you don't have to, so you don't have to buy both necessarily. I mean, I would say if you buy them together, you're eventually going to have to separate them out, but we can talk about that later and you can talk to your rep about it. So the Emsculpt is patented non-invasive technology for muscle and fat, and it has 5 approved patents. So the body is made up of 16% skin, 25% fat, and 35% muscle. So muscle, you know, obviously is a big deal. Let's look at some of the competing technologies, but you'll see why they're really not very competitive. So CoolSculpt, sculpture, cavitation, ultrasound, things like that work on fat only. And high intensity focused electromagnetic energy works on fat and muscle. And I'll talk a little bit about why that is. So, and again, we're going to look at laser, something like sculpture, ultrasound, cryo, like CoolSculpt, radio frequency. So basically what this graph is showing is that Emsculpt doesn't have consumables. It can treat patients who have a lower BMI and just want muscle strength. And the big thing is that Emsculpt treats the muscle and the fat. And none of these other technologies offer buttock lifting, and the other technologies do have a risk of burns, and burns certainly have been reported. There are 0, and I really do mean 0 complications or adverse effects from Emsculpt. We haven't had any problems whatsoever. So the high intensity focused electromagnetic energy, as far as Emsculpt goes, it causes 20,000 powerful muscle contractions per session. So patients are generally coming in for 4 sessions over 2 weeks, but each session gives them 20,000 muscle contractions. Emsella gives them 12,000 contractions per session, and that's generally six sessions over 3 weeks. And you can see, so both of them have phases. There's a phase called unfused, which is about 3 seconds or so, blasts of 3 seconds, and it's unfused. Then there's fused, and the fused stimulation pattern keeps the muscles in kind of a tectonic contraction for about 5 seconds. So you get tectonic contraction, and then the third phase is twitching, which is interesting. Twitching actually brings the lactic acid out of the muscle. So surprisingly, even though you're getting 20,000 powerful muscle contractions, you really aren't very sore, you know, a little bit sore, you know something happened, but that's about it. I mean, you can leave after Emsculpt or Emsella, go to the gym, go to work, whatever. There's no recovery time with either of these technologies. So again, the thing to emphasize to the patients, and the thing that is absolutely true, is that these supramaximal contractions can't be achieved on their own. So why does Emsculpt affect the muscle and the fat? I mean, you know, you can see why it affects muscle because you're causing all these contractions, and this creates hyperplasia and hypertrophy of the muscle. Why does it affect fat? Well, because there's a cascaded apoptotic, it's hard to say, effect. So look at this here. So the muscle contractions are so rapid and so strong that the muscles try to recruit free fatty acids from the surrounding fat cells, and it overwhelms the fat cells and causes the apoptosis. So you know you have a finite number of fat cells. You're overwhelming these fat cells, breaking the cell membrane, spilling the free fatty acids, and the macrophages come in and break down the free fatty acids, and they're excreted in the urine. So you've got hypertrophy, hyperplasia, and apoptosis, which causes muscle growth and fat loss. And that's the science behind it. Just a second here. Okay, so Emsculpt, large applicators. I think the thing to remember with both these technologies is that once you discuss this with the patient, and you're going to discuss it with the patient because the patient is going to see the video loop in your waiting room and the banners and the brochures, and she will have potentially talked to friends who have had Emsculpt done. So once you have that conversation, and then, you know, say a patient comes in for annual exam and she says, hey, you know, I saw this video in your waiting room and that really looks interesting to me. I've got a little bit of fat in my belly and I kind of like to get rid of it. Do you think I'm a candidate? And, you know, she's not, I'm going to say no, but most people are. And then you take them back and you put the Emsculpt applicator on their belly and show them what it feels like, so they can kind of see, touch, and feel, get a sense out of the conversation of what it might be like to have, say, better looking buttocks or a flatter abdomen. And once she signs up, you're done. I mean, you don't, you know, you may want to go by and say hi when she's sitting on the machine, but that's about it. You're done. So we have an aesthetic medical assistant, and she's fabulous and works with the patients. You can leave the patient alone with a buzzer just in case they need you for some reason. But I mean, you can have, I usually have her stay with them most of the time, but you really don't have to do anything. It's not going to demand anything of your time once the patient signs up for an Emsculpt series. And oftentimes they'll sign up for the Emsculpt series, say on the abdomen, and then they want to do their buttocks because the abdomen worked out so well, and then they want to do their arms, and then they want to do Emtone, and you know, we have what we call our frequent flyers, and these patients end up doing, you know, many treatments. So Emsculpt, usually we recommend it in 4 30-minute treatments, twice a week for 2 weeks, but we have some patients who live a distance from Scottsdale. You know, they come in from Flagstaff or they come in from wherever, and they're coming in once a week for 4 weeks, generally speaking, and that's perfectly fine. So what about the buttocks? Patients certainly do not want to have buttocks implants. In fact, I think they're illegal in England because there have been so many complications. So this is very attractive to patients, you know, looking at the summer coming up, being in bathing suits. So the buttocks protocol, or protocol 2, does not burn fat. It just builds muscle, but it builds muscle and lifts the buttocks up so they have that nice round look to them. Another application for Emsculpt is in patients who have had a baby and have rectus diastasis. So when a patient is pregnant, the baby's growing, and the rectus muscles separate in order to allow for the baby's growth. Once the woman has the baby, oftentimes those rectus muscles don't completely go back together, and she can kind of put her fingers in there, or when she does a sit-up, she can see a little bulge. So the Emsculpt is great in reducing that distance between, you know, building the rectus muscles and reducing the distance between the two muscles. And surprisingly, 66% of moms have abdominal separation, and those with abdominal separation are very likely to have pelvic floor dysfunction as well. It's that whole delivering a baby thing. It really does, you know, really does take a hit on the body. So, so why have 2 different sets of applicators? Well, because I'll get into it a little bit, but these smaller applicators are meant to fit around the arms, and so you can treat biceps and triceps. And I'll tell you, in my practice, the difference in the look of the arms just in 4 treatments is really dramatic. I mean, these women are ending up with guns. So this is for 20-minute treatments twice a week for 2 weeks, although again, they can extend it out further than that. These applicators are also great for the calves. Why could you use your large applicators on the arms? Well, because the electromagnetic field is too big and you're losing energy, and also it penetrates too deeply. So particularly in a small patient, you're going to stimulate antagonistic muscles and hit the bony structures. With the small applicators, the energy is focused and it only penetrates 4 centimeters, whereas the larger applicators penetrate about 7. So let's look at some of the research. We'll go through these slides fairly fast because, you know, who likes research slides? Anyway, the point of this first slide is that you have 3 different researchers, you know, looking at the results of Emsculpt, and they came out, they concluded with very similar numbers. So an 18-19% reduction in fat, a 15-16% increase in muscle mass, and about a 4 centimeter decrease in waist circumference. And then in this second area here, you're looking at buttocks, 85% overall improvement and 80% significant lifting effect. And we'll look at some pictures in a little bit. So this was a porcine study looking at histology. So I mean, the pictures say it all here, but there was so what they showed with this study is that there's a 23% increase of muscle mass density, 16% increase in muscle fiber volume, and a 7% increase in muscle fiber density. And again, you can see this just looking at the pictures. It's obvious that the muscle has increased in bulk. So looking at free fatty acids, obviously, if you're breaking up fat cells and you're releasing free fatty acids, you're going to see this reflected in the blood. So here we have the patients who are treated with Emsculpt and the controls, and you can see that before the treatment and as opposed to after the treatment, you have an increase of free fatty acids, 134% increased level of free fatty acids. And also you have a pH drop, which again reflects the addition of free fatty acid to the bloodstream. So this was a CT study, and I mean, again, the picture says it all. So we're looking at a fat layer here and a muscle layer here, and you can see 1 month later that the fat layer has decreased and the muscle layer has increased. So the average fat reduction, again, the same numbers, is 19%, and the increase in muscle mass is 16%. And if you look at rectus diastasis, it's 11% reduced. This is an MRI study. Again, you look at this fat layer here as opposed to the muscle layer, and you're reducing the fat layer and increasing the muscle layer. Here, and now this is an interesting study. This looked at these patients, the Emsculpt patients, 1 year later. So if you look at abdominal fat thickness, initially it was reduced by 17 and change %. And a year later, it's still reduced by 14%. So, so that's pretty consistent. These patients, you know, there are a finite number of fat cells, and once you break them up, you're not going to grow anymore. Now, obviously, if the patient eats a lot, you know, individual fat cells can get big and they can get small. So you certainly, you know, these patients do not want to be gaining weight. Abdominal muscle thickness, interestingly, initially increased by 17%, and a year later it was 19%. So, you know, that's were these patients working out? You know, it's hard to say. And the width of abdominal separation really pretty much stayed the same. So this is an ultrasound study, and again, the pictures say it all. This is a fat layer, 1 month follow-up, and a 6 month follow-up. So once again, you have a finite number of fat cells, and once you break them up, it's, you know, you're gonna retain your results. This is looking at arms and calves. The increase in the mass of the size of the biceps was 17%, triceps 10.2%, calves 14%, and also there was a 12% decrease in arm fat, or, you know, those bat wings that women hate so much. So here are a few pictures, and these aren't, I mean, you're going to see, if you look at social media, you'll see before and after pictures like this all over the place. So these are not cherry-picked as the very best ones. It's just, these are examples, but they're not unusual examples by any means. So you can look here, look, you know, significant difference in the abdomen. You can particularly see it on the side image. Again, significant difference in the abdomen. You see flattening of the abdomen here, flattening of the abdomen here, and here. I mean, that's a great example. And then the buttocks, you can see that the buttocks are lifted up with the Emsculpt on the buttocks. And arms, as I said earlier, the arm treatments are probably the most instantly dramatic results. You can really see the difference after 4 treatments in the biceps and triceps. And we generally combine, when a patient comes in and wants to treat his or her arms, I do encourage them to treat both the biceps and the triceps. And this is increase in calf muscle, so very dramatic again. And Emsculpt has really become a bit of a media sensation. If you look at Real Self, which is kind of the Yelp of the aesthetic world, the increase in growth for Emsculpt was 450% in a year. You know, the next contender here is only 64%. So people are very interested in Emsculpt. And one of the reasons is that Real Self has evaluated and asked these patients, you know, what's most important to you? And safety is rated as the most important piece of information when researching non-surgical cosmetic treatment. And Emsculpt is totally safe. And you can see here, consumer interest is up by 98%. So Real Self is getting a lot of interest, a lot of questions, and they send out a lot of referrals for Emsculpt. And celebrities love Emsculpt. I don't watch television or watch movies, so I don't know who most of these women are, but I think this is Kim Kardashian. That's Drew Barrymore, and she is the spokesperson. And I don't know, again, I'm kind of a media not informed person, so you probably know who these people are. But it has gotten a lot of attention from celebrities. Let's see, okay. And also athletes. There are a number of athletes who are very excited about and do use Emsculpt. There are athletes who come in on a regular basis just to, you know, just to keep that muscle mass up. So let's switch over. Let me get a little drink of water here. Let's switch over to Emsella. Okay, so core to floor, you know, the core being Emsculpt, and obviously the floor being Emsella. So with the Emsella treatment, it's same energy, high intensity focused electromagnetic energy, and it really retrains the pelvic floor muscles. Pelvic floor muscles weaken for a number of different reasons, but the Emsella is designed to restore the neuromuscular control and also increase the strength of these muscles and retrain these muscles. So when we first got the Emsella, it was purely for incontinence, although we noticed that patients came in and said, hey, you know, this is great for my incontinence, and I'm not losing urine anymore when I cough or sneeze, but also, boy, I had an orgasm the other day and it was a lot stronger, and this has really helped my relationship with my husband. It's more satisfying for both of us because my muscles are strengthened. So Emsella now has 2 protocols. The first protocol, generally we use the first protocol for older women who probably, you know, who aren't sexually active and they're just wanting to treat their incontinence. But for a patient who is sexually active, we can use the protocol 2, which is stronger energy and actually works on these pelvic floor muscles a little more aggressively than the protocol 1. And, you know, we find that older patients in their 70s and 80s, we've had patients in their 80s, they don't tolerate the strong, you know, the protocol 2 as well, but certainly younger patients do, and they really appreciate the effects. So when you're talking to a patient about Emsella, you want to you want to emphasize that will help with incontinence. And once again, you want to have video loops in your waiting room, you want to have banners, you want to have brochures, and also, on your intake form, you want to ask, are you experiencing issues with incontinence? I have mostly a menopausal practice, and many of my patients are dealing with incontinence. So you've seen these slides before. Here you have, this is an ultrasound before and after Emsella of the pelvic floor muscles, and you can see that the muscle starts out at a little streak here, and after 6 sessions of Emsella, really significantly increases in bulk. So why Emsella? Why do they name it Emsella? EM stands for electromagnetic, and Sella means chair in Latin. So so it's a chair, it's comfortable. Patients can be fully clothed. They can, come in at their lunch break and sit there for 28 minutes and go back to work. They can go to the gym. They can, do whatever they want. There's, again, you have the 3 modes. So the third mode is twitch, and it gets the lactic acid out of the muscles. So these patients aren't even particularly sore. They can kind of feel that something happened, but they don't experience soreness. I generally have patients strip down to their underwear and sit on a pad. We put a pad on the Emsella chair, because I don't want, it only penetrates a certain amount. It penetrates about 10 centimeters, and you don't want to lose some of that penetration with a pad or thick jeans or, whatever else they're wearing. So, so Emsella is FDA cleared to provide entirely non-invasive electromagnetic stimulation of the pelvic floor for the purpose of rehabilitation of weak pelvic muscles and restoration of neuromuscular control. Now, this applies to men and women, and we've had a few men use our Emsella chair. One of them just started. He's had a prostatectomy and is having some issues. The other one started a few weeks ago, and he's so far thrilled with the results. So you can use this on men and women. And it does increase vascularity, and of course, with every new vessel that grows in, you get a nerve. So, so it increases the muscle strength and also increases the, the sensation. Let's see. So what are the other potential treatments for incontinence? Well, there are behavioral changes, and that's certainly, empty your bladder more often. That's pretty straightforward. Kegel exercises. So Kegel exercises are useful, but they're a whole lot more useful after 6 treatments of Emsella. Biofeedback, physical therapy, they're all useful, but Emsella is a much more dramatic solution to incontinence. Sorry, that's a phone I didn't think was going to ring, but anyway, we'll just ignore that. So also transvaginal electrical stimulation and radio frequency stimulation. We have radio frequency vaginal treatment, and we actually combine it frequently with Emsella. Emsella treats the muscles. Radio frequency treats the tissue. It increases collagen and elastin. So the combination of the two has been something that we often utilize to treat patients who are incontinent. So the benefits are that patients can remain fully clothed, it's not invasive, they can walk in, walk out, it's operator free. And Emsella is totally operator free. I mean, once you talk to the patient about it, you take her back, you sit her on the chair for 2 minutes, let her feel what it feels like, get a sense, get a kind of see, touch, and feel. And she wants to buy the package because obviously she wants to treat her incontinence. Then you're done. You don't have, and you can go by and say hi once in a while, but that's about it. There are no consumables, and we'll get into this a little bit later, but it brings in significant increased revenue. So let's look at the market. So the number of feminine procedures grows by 27% a year. There are 19 million US women and 200 million people worldwide who suffer from incontinence. 45% of incontinent women report the loss of intimacy. I mean, you know, some of these women actually lose urine when they have an orgasm. How embarrassing is that? That's terrible. And 54% of cases of women who are incontinent, and men also, report the loss of confidence. I mean, who wants to go to a party or out on a date and worry about losing urine when you laugh or cough or sneeze, or, you know, and wetting your pants? I mean, you know, that's not attractive. And this is embarrassing. It's very embarrassing for both men and women, probably a little more embarrassing for men. But 5 out of 10 women don't seek help, and the statistics are that it takes 6.5 years on average from the first symptoms to a patient seeking help. And more about the market, a patient who is, or a woman or man who is incontinent spends about $900 a year on products like Depends and pads and things like that. There, in 2010, there were 12.8 billion adult incontinence products sold globally, and in 2015, 18.5 billion adult incontinence products, and the volume is always growing. So there are 3 types of urinary incontinence: stress, urge, and mixed. Stress is losing urine when you cough, sneeze, last jump, you know, laugh, jump, whatever, step off a curb, get up from a chair, whatever. Urge incontinence is a situation where you feel the need to urinate and you can't make it to the bathroom. And many patients have a combination of the two, which is called mixed incontinence. Stress incontinence is mostly postpartum women. I have patients in my practice who have never had a baby and they still have stress incontinence. Urge incontinence is that, you know, that urge that where you can't make it to the bathroom, and that affects all ages. And the mixed is mainly postmenopausal women, but I have a lot of premenopausal women who have mixed incontinence. So here are the pelvic muscles. There's a hammock of muscles in the base of the pelvis in both men and women, and these muscles get saggy. They get saggy in both men and women. So with the Emsella, the muscles tighten up. And one of the functions of these muscles is to contract and stop the urine from coming out when a patient coughs or sneezes or laughs or has the urge to urinate. So these muscles, you know, would actually contribute to continence because of their contractive mechanism. So here's a little video. So this is the Emsella chair. The woman sitting on the Emsella chair, you can see the muscles are kind of lax to begin with, but after the Emsella treatment, they do tighten up. I mean, she's sitting on the chair, she's comfortable. She can feel that something's going on, but it's not painful. And you can see this ultrasound, it really tells it all here. You can see the muscles contracting with the pulses of energy. So we've pretty much already been through this. It's high intensity focused electromagnetic energy, and a single session brings thousands, or 12,000 to be exact, supramaximal pelvic floor contractions, and it re-educates and strengthens the muscles. I show this to all of my patients who are interested in Emsella or, you know, have any kind of issue with incontinence. So this is what a woman can do with Kegel exercises. This is the frequency, and here's the intensity. Because I get asked that, well, what if I just do a whole lot of Kegel exercises? Can I accomplish the same thing? No, you can't. Because this is the frequency of contractions with the Emsella chair, and this is the intensity. So no, you can't accomplish it on your own. Now, once you strengthen those muscles, then Kegel exercises are going to be stronger. You're going to be more aware of the muscle contracting. And in order to maintain the effects of the Emsella chair, we do recommend that patients do Kegel exercises on a daily basis. So it's the Emsella treatments are scheduled 6 treatments over 3 weeks. It takes 28 minutes for each session, but they can extend this out. Again, if their schedule doesn't allow them to come in twice a week, you can extend it out and still get the same results. 6-month follow-up. I will tell you that, yes, my patients still experience less loss of urine, sometimes no loss of urine, no requirement for wearing pads after 6 months. But many of the patients are so happy with the results of the Emsella chair and the fact that they're not losing urine anymore, that as soon as they feel it slip even a little bit, they come right back in. So we have what we call the Emsella Club, and patients are, we reduce the price a little bit, and they can make an appointment and come in anytime. They can come in once a month, once every 2 months, and sit on the chair. And that has been a very popular club. So look at the studies. There are 6 completed clinical studies, 500 study patients. There's a 95% satisfaction and significant improvement in the patient's quality of life, 65% average improvement of urinary incontinence, and the results are confirmed in 6 months. So this is a study with 30 patients. Again, same numbers, 95% reported definitely an improved quality of life. Same thing here. We'll go through these quickly. Yeah. Okay, so we'll move through the rest of these slides so we can get to some questions. But so when can patients see the results of Emsella? Well, oftentimes they see a result after the first session, and they're thrilled and certainly motivated to continue to come back for the 6 sessions. How long do the results last? Well, certainly 6 months, 85 to 95% satisfaction rate still at 6 months. And again, I touched on this earlier, you can combine these treatments. So Emsella treats the muscles, and you can combine it with something like a radiofrequency of the vagina. So what about, what does the pelvic floor do? What are the advantages of strengthening the pelvic floor? Well, continence, obviously, stability to the spine and pelvis. And it has those muscles have a very important role in sexual function and also a protective reflex. I mentioned this earlier that now the Emsella chair can be actually purchased as an application to add to the Emsculpt machine. So you don't have to purchase a completely separate set of machines for the Emsella chair. You can purchase the chair and plug it into your Emsculpt machine. So, and then looking at, we're going to be back to Emsculpt here. It does help with back pain. We do lose muscle as we age, and Emsculpt certainly increases that muscle mass and increases strength. And if you look at it, as far as this, as far as increasing strength and helping older people, every 11 seconds an older adult is treated in the emergency room for a fall, and every 19 minutes an older person dies. Again, women who have had a baby, a month of inactivity can reverse 6 months of gains, and 2/3 of moms have abdominal separation. 20% of women stop exercising due to incontinence, and many patients who have recently delivered do experience some incontinence. And with men, men tend to be a little more secretive and a little more, not as prone to having, say, a tummy tuck. I mean, how many men do you know have had a tummy tuck? So the daddy do-over is a very real thing, and men lose muscle mass just like women do. And of course, incontinence is a big problem for both men and women. So let's get to the return of investment. So in an ideal situation, if you were running that Emsculpt 8 hours a day, 5 days a week, 52 weeks a year, you would make about a $3 million profit. Now, more realistically, say you're going to have 12 patients a month, but that's still going to increase your revenue by $432,000 a year. These are my numbers. These, looking at December 1st, 2018 to February 25th, 2020, we did 700 billed units of Emsculpt and took in $404,000. We did 1,500 units of Emsella and took in 393,000. So, you know, obviously an influx of $798,000 into my practice made a huge difference. This just demonstrates that you can, you know, if you have, say, 2 people who only need 1 applicator on their belly, larger people need 2 applicators. But if you have 2 people who just need 1 applicator, you can tandem it and charge each of them less. So coming out of COVID-19, you know, we've all taken a hit on our practice. I have stayed open, and for about probably about a month, we had half the number of patients who we normally see, and we had to decrease, you know, hours of our employees. But things are coming back. I just Tuesday I was in the office and I scheduled and I signed 2 people up for Emsella packages, and another is probably going to sign up. So patients are coming out of being stuck in their houses. They haven't been able to exercise. You know, they've been gaining a little weight because what is there to do besides eat? And they're going to be more interested in these kinds of aesthetic procedures. And I think, you know, I think this is a good time actually to start diversifying your practice and offering these sorts of options